series
Thank you for joining us for Spurbs Herbs episode 115. We're going to be in an interesting herb today. We're going to talk about bu shi zao, or Centipeda herba, or small Centipeda herb. And that is what we're going to be talking about today. We are going to be looking at another single Chinese herb. This herb is a relatively obscure herb in the Chinese medical subcategory of warm, acrid herbs that release the exterior under the category of release the exterior herbs. Not a very commonly used herb. In fact, it isn't even included in several of our usual textbooks, but it can be useful. And as always, we will look at something a little different. We're going to look at a biochemical and supplement, quercetin. Please join us for this scintillating episode. And here we are. I want to talk to you about our amazing special because this is the last time I'm going to talk about it. This is the end of it. So please do it quickly. We have an amazing special for our courses. If you use them for continuing education, professional development, or just for your own edification, we are offering 50 hours of courses for an unbelievable price. Normally this would cost $750. However, with the special code 50 CEUs or 50 CEUS, this is going to be only $325 or less than half off. Plus, you can get a free signed copy of one of my books. Just pay for shipping and handling. That is a free copy of Integrative Pharmacology, combining modern pharmacology with integrative medicine, or Playing the Game, a step-by-step approach to accepting insurance as an acupuncturist. That can be up to an $80 value in and of itself. Just go to the webpage www.integrativemedicinecouncil.org/CEUS1. That's Integrative Medicine Council, COUNCIL.org/CEUS1 for this amazing deal. But hurry, it is about to end. Okay, let's talk about quercetin. It's going to take a little while. Once we get to discuss constituents of today's herbs, bu shi zao, there is one interesting component, quercetin and its derivatives. It may not be one of the main constituents of this herb. However, it does seem to be one of the more medicinally useful. I did a monograph on the supplement, and yes, it is a supplement. You can purchase it over the counter, at least in the United States, in my Integrative Nutrition course, Class 14. So I include that monograph here as something a little different and to further explain this herb's medicinal effects. Quercetin is a flavonoid found in numerous foods, including onions, kale, radicchio, some berries, buckwheat, black plums, and capers. It's also found in ginkgo biloba, St. John's wort, and sea blackthorn, as well as the Chinese herbs huaimi, sibaye, gao liangjiang, guangdong hua, and sangye. And of course, our today's herb, bu shi zao. Its natural form includes glycosidic attachments and is called rutin, which is about half quercetin. Average daily intake of quercetin from food sources is about 25 to 50 milligrams per day. So what is it used for? There has been almost no research on rutin, and all the effects and uses are based on quercetin. Quercetin's pharmaceutical effects based on in vitro and animal studies include being anti-carcinogenic, so anti-cancer, antiviral, and anti-inflammatory. Potential uses for quercetin include treatment for prostatitis, decreasing blood sugar and insulin resistance, lowering blood pressure, arthritis, seasonal allergies, viral infections, cancer, fatty liver disease, and improving memory and cognition, exercise, sleep, and testosterone levels. But what does the science say about all these potential uses? According to Evans, in a double-blind, placebo-controlled, randomized crossover study in healthy volunteers, quercetin at 1 gram per day, remember we normally get 25 to 50 milligrams per day, 1 gram per day supplementation for 2 weeks reduced oxidative damage to erythrocytes or red blood cells. In a double-blinded, randomized, placebo-controlled trial in patients who previously suffered a myocardial infarction, quercetin at 500 milligrams per day, so half that dose, supplementation for 8 weeks increased the serum total antioxidant capacity, so it really helped antioxidants. A very small n equals 28, n meaning number of subjects. And remember, we're always looking for at least 30 to 40 subjects because then we can apply population statistics to it. A very small and older study from 1999 showed some help with chronic category 3 prostatitis, but there was no other obvious research for this intervention into this condition. So I would not put this as evidence at all for helping prostatitis. It's too small, too old. There's been no corroboration. Don't think I wouldn't. I'm not saying it's not good for prostatitis. I'm saying there's not. I wouldn't consider this evidence for its use for prostatitis. According to Cooperman, and I love Cooperman. I always want to talk about Cooperman whenever I refer to him. Cooperman, Dr. Todd Cooperman, he runs a website that is called consumerlab.com, and I love this website, consumerlab.com. And what's great about this website is they have wonderful monographs on all kinds of supplements and herbs and all that, but then they also take the added step where they purchase a dozen or two of each of these different supplements and go get them tested for adulterants. Does it have what it says it has on the bottle? And they compare how much it costs, and they come up with brands that you should actually purchase if you want these supplements. So I love it as a resource. They do charge an annual fee. It's one of the ones I love paying every year, and so I think it's like 45, give or take, a year at this point. It's gone up. I think I started subscribing when it was $20 a year or something like that. But it's a great website. So it's Cooperman. That's where Cooperman's from, and it's called consumerlab.com. I'm pretty sure it doesn't have an S. I always get that mixed up. So according to Cooperman, there is some evidence that quercetin may slightly decrease fasting blood sugar and insulin levels, but lower doses, 100 to 730 milligrams daily, showed no benefit to adults with metabolic syndrome. A small study, n equals 40, so just barely statistically valid, and just women, concluded 500 milligrams per day quercetin supplementation for 8 weeks resulted in significant improvements in clinical symptoms, disease activity, high sensitivity tumor necrosis factor alpha, or TNF alpha, and health assessment questionnaire, HAQ, in women with rheumatoid arthritis. So interesting. So it might help with that. The systematic review and meta-analysis, these are the kings of systematic reviews and meta-analyses are some of the best science out there. And this is from the journal, published in the Journal of the American Medical Association. So again, a well-regarded journal. Concluded the results of the meta-analysis showed a statistically significant effect of quercetin supplementation in the reduction of blood pressure, possibly limited to or greater with dosages of greater than 500 milligrams per day. So that's pretty good evidence. Further studies are necessary to investigate the clinical relevance of these results and the possibility of quercetin application as an add-on to antihypertensive therapy. According to Cooperman, quercetin, when mixed with resveratrol, showed mixed results. Similarly, a few questionable, small, and or funded by manufacturers studies showed some but minimal or no benefit to using quercetin for seasonal allergies. A meta-analysis concluded this meta-analysis indicates that quercetin supplementation is unlikely to prove ergogenic for aerobic-oriented exercises in trained and untrained individuals. So ergogenic means prove energy is really for, in other words, it doesn't necessarily help with people doing aerobic exercises in either trained or untrained individuals. So not useful for having more power in your exercise, at least aerobic exercise. Quercetin has been shown to have antiviral properties in vitro, which means in glass, and in mice, so that would be in vivo, not necessarily clinically. While hailed as a potential natural preventer and treater for COVID-19, the evidence is very minimal and very small or smallish in manufacturer-funded studies. So I wouldn't say It may have antiviral properties, but it hasn't been shown clinically, so I wouldn't put a lot of faith in that. And as the sub point to that is COVID-19, and it doesn't look like there's support for that at this point. There have been some animal studies, but no clinical studies examining the use of quercetin to raise testosterone, help sleep, or treat cancer. And I don't give the results of these because animal studies are not humans, and it doesn't mean anything in humans. Just because it does or doesn't do something in animals does not mean it does or does not do something in humans. We do animal studies for a little bit for safety, but also because it can be helpful to get funding for human studies. But the human studies, the clinical studies, are the important part. A small n equals 36, so very borderline as to whether it's statistically valid. Double-blinded, randomly controlled trial, so that's good. Concluded 12 weeks treatment of quercetin could reduce intrahepatic, so inside the liver, lipid contents in patients with non-alcoholic fatty liver disease, or NAFLD. Other considerations, there are several forms of quercetin available on the market. The most common forms of supplementation is in free form or quercetin dihydrate. Both of these are poorly water soluble, and only about 2% is absorbed with water. They should be taken with a high-fat meal. There is an enzymatically modified isoquercetin, a quercetin glycoside called EMIQ, claimed by its manufacturer to be much better absorbed. Another version by another manufacturer, quercetin phytosome, also claims to have better absorption. In general, natural forms of quercetin in foods have better absorption than quercetin in quercetin dihydrate supplements. Dosage in general, dosing is 500 to 1,000 milligrams per day. For chronic prostatitis and to lower blood sugar and insulin, 500 milligrams twice daily are used. For rheumatoid arthritis, 500 milligrams daily is used. To lower blood pressure, 500 to 1,000 milligrams daily is used. Side effects and red flags. Adverse effects tend to be uncommon and include usual effects such as nausea, stomach upset, and headaches. Taking quercetin with foods minimizes stomach upset. Animal studies indicate quercetin may exacerbate kidney disease, promote estrogen receptor positive breast cancer cell growth, and bind to iron and inhibit absorption. Combining with alcohol may slow breakdown of alcohol. In other words, the alcohol stays in the system longer. Interactions. Quercetin may inhibit a transport protein, OATP1B1, cytochrome P453A4, and cytochrome P452C9. So there can be definitely some potential interactions, drug-herb interactions with these, especially with the 3A4. 2C9 is also, 3A4 is about 40 to 60% of drugs. 2C9 I think is about 20% of drugs, still significant. And both of these are clinical. Their evidence level is C for all three of these actually. So that means there is some evidence of this in humans. What is quercetin according to Chinese medicine? If you look at the Chinese herbs that contain quercetin, there are no obvious similarities, with some being warm, some being cool, varied properties and actions. I think several actions of quercetin may point to it being cooling, including reducing blood pressure, being anti-inflammatory, and antiviral. As one of its more scientifically established effects, quercetin may clear heat toxins, as being antiviral is common among the herbs with this action. Based on lowering sugar levels and blood pressure and helping NAFLD, quercetin may be blood moving and or damp phlegm clearing. Based on these potential actions, quercetin may enter the spleen, liver, and lungs. Okay, that is quercetin. Let's get into today's herb. Today's herb is a little more obscure than our regular herbs, or maybe quite a bit more than our regular herbs. It is not included in several of our usual textbooks, including Brandon Wiseman's 2008 Concise Chinese Materia Medica, Wang's The Pharmacology of Chinese Herbs, and Zhao and Chen's Chinese Medicinal Identification and Illustrated Approach. So in other words, I have a lot less information to give you because those three textbooks are out of the offing. It is from the family Asteraceae, which we're going to talk about in just a minute. Standard species is Centipeda minima, L in parentheses. That L, remember, refers to Linnaeus, who was the first one to categorize plants and animals, and it's in parentheses because it's been revised, and that revision is happening with Abron and Ashers. Again, you can always look up these biologists and get their full name and explanations there. The medicinal part is the whole herb. In English, the literal English for this translation, Abu Shir Zao, means herb not eaten by geese. That's an interesting name. Other names, there's lots of other names, all in Chinese. In fact, this is interesting, it's the only herb we've come across so far that doesn't have Japanese, though it does have a Korean name for it. So other Chinese names include Baiju, Sizhao, Dihu Jiao, Qijian, Niu, Wei, Ji Zao, Sanxing Zao, Shihu Jiao, Shihu Wei, Dai Zai Zao, Mantian Qing, Tangtian Xiao, Toji Da, Xiao Long Jian, Xiao Chuan To, Zhi Zao, and in Korean it's, again, I don't speak Korean, so I'm doing my best here, Abu Sikcho, I guess is how you pronounce it, ish. Asteraceae family. We have covered this family fairly recently, and here we are again. According to Britannica, the Asteraceae family, also called Compositae, is commonly known as the aster, daisy, or composite family of the flowering plant order Asterales. It includes more than 1,620 genera and 23,600 species of herbs. That's big. This is a big family. Herbs, shrubs, and trees distributed throughout the world, and is one of the largest plant families in existence. There are many well-known plants in this family, including many garden ornamentals, weeds, including dandelion, ragweed, and thistle, food crops, lettuce, artichokes, safflower, sunflower, and endive, as well as several Chinese herbs. Members of the family have flower heads composed of many small flowers called florets that are surrounded by bracts, or leaf-like structures. Bell-shaped disc florets form the center of each head. Strap-shaped ray florets extend out like petals from the center and are sometimes reflexed or bent back. Another interesting article agreed with this overview and looked at how this family plays a role in human health, including antioxidant, anti-inflammatory, and antimicrobial activity, as well as diuretic and wound healing properties. We'll see some of these play a role in our herb today. So going back to our herb today, Bensky and his team say the dose is 6 to 9 grams, and dosing is actually quite important on this herb, and we'll see why in just a little bit. And Chen say 3 to 9 grams, so even maybe a little bit less if necessary. Category, according to Bensky and his team, put this herb in the warm acrid herbs that release the exterior subcategory under the herbs that release the exterior category. And Chen similarly say it is in the wind cold releasing herbs subcategory under the category of exterior releasing herbs. Bensky and his team say this herb is acrid, slightly warm, and enters the lung, while Chen says it's acrid, fully warm, not slightly warm, but warm, and enters both the lung and the liver. So a little bit different between the two books. History of this herb. This is an interesting herb as it is the only one we have come across so far where Chen do not list an original source. Bensky et al. Say it was first mentioned in the Materia Medica of Diet Therapy, or Shilao Ben Cao, written by Meng Shen in the 7th century. So not one of the oldest herbs, but not one of the newer ones either. Let's talk about exterior releasing herbs. We have now discussed this category and subcategory of herbs several times during our adventures examining Chinese herbs. Today, rather than quoting Bensky and his team, let's look at what Chen have to say about this category of herbs. Substances that release the exterior act to dispel pathogenic factors from the external and superficial parts of the body. The term pathogenic factors describes normally benign environmental factors such as wind, cold, or heat that have combined to disrupt normal physiological functioning and express themselves in the form of wind cold and wind heat. With drastic or sudden changes in the weather or with a decline in health or immunity, these factors commonly attack the exterior or superficial parts of the body, that is, the skin and muscle layers. Therefore, an exterior syndrome refers to a condition characterized by wind cold or wind heat attacking or invading the skin and muscle layers of the body, causing symptoms and signs such as aversion to cold, chills, fever, headache, muscle aches and pain, the inappropriate presence or absence of perspiration, and a superficial pulse. The herbs in this category stimulate immune response, alleviate pain, regulate body temperature, and induce perspiration. They are most often used to treat common colds, influenza, and complications of complex internal disorders. Clinically, exterior releasing herbs fall into two categories to address the problems of exterior wind cold or exterior wind heat syndromes. First is dispel wind cold. These herbs are generally acrid and warm in thermal property. They induce perspiration, dispel wind cold from the exterior, and promote warming and relaxation of the skin and muscle layers. The second category is dispel wind heat. These herbs are commonly acrid and cold in thermal property. They dispel wind heat to relieve fever and pain or inflammation in the throat, eyes, and skin. Herbs from both categories are generally used in the treatment of common colds, influenza, bacterial infections, asthma, coughing, wheezing, measles, chest congestion, nausea, vomiting, edema, arthritis, and eye disorders. Herbs that release the exterior may also serve multiple purposes: to regulate qi circulation to relieve pain, relieve wheezing and dyspnea or trouble breathing, dissolve phlegm, promote the eruption of measles, relieve nausea and vomiting, regulate water circulation, and eliminate dampness and brighten the eyes. Accurate differential diagnosis of the external pathogen and the degree to which it has penetrated is of vital importance. Treatment of wind cold and wind heat can be significantly different. Furthermore, it is important to determine the basic underlying condition of the patient prior to prescribing any herbal formula. Pre-existing constitutional deficiency or chronic illness may require the addition of tonics to enhance the overall therapeutic effect. However, tonics must not be used alone or casually in the presence of an exterior condition, as this will only send the pathogenic factors deeper into the interior of the body, thus complicating the illness. Cautions and contraindications. Many herbs that release the exterior do so via inducing perspiration. Overdose, prolonged use, or inappropriate use of these herbs will consume qi and body fluids, resulting in qi deficiency, dryness, and/or yin deficiency. Therefore, they should be used only when necessary. Furthermore, intake of these herbs should be discontinued immediately when the desired therapeutic results are achieved. Herbs that release the exterior should be prescribed with caution for individuals who have a deficiency of qi, yin, blood, or body fluids. Exterior releasing herbs should be used with caution in patients with an exterior condition accompanied by sores and abscesses, Lin-Zheng or dysuria syndrome, that's trouble urinating, or bleeding. Processing. Many herbs that release the exterior are aromatic and contain volatile essential oils. Cooking these herbs for a prolonged period of time causes evaporation and destruction of many active constituents. Therefore, these more volatile herbs, often leaves and flowers, should be added at the end of the cooking time for the main formula so that they are only decocted briefly, simmering for no more than 5 minutes, long enough to release their potent influence without diminishing their actions. The practice of adding the herb at the end of the cooking process is referred to in this text as post-decoction. Pharmacological effects of this category of herbs include diaphoretic, which means sweat-inducing, perspiration-inducing, antipyretic, helping fevers, sedative, antibiotic, metabolic, hypoglycemic and raising the metabolic rate, diuretic, meaning promotion of urination, cardiovascular, increased perfusion of the coronary arteries, antispasmodic, analgesic, pain-relieving, anti-inflammatory, and anti-venin, so anti-venom, basically. So that's the overall category of release the exterior. Here we have Bensky Specifically, and his team discussed the subcategory of warm acrid herbs that release the exterior. Herbs that release the exterior can be further divided by character and function into warm acrid and cool acrid classes. The warm acrid herbs dispel wind cold and are used for exterior disorders when the fever is mild, the chill severe, and there are other signs and symptoms of wind cold, including headache, body and neck pains, and absence of thirst. So good quality of Shirzao. According to Bensky and his team, good quality is grayish green and has a strong flavor which can provoke sneezing if sniffed. And the other textbook that we usually talk quite a bit about with quality is the Chinese Medicinal Identification and Illustrated Approach by Zhao and Chen, but they do not include an entry for this herb. It's the first Chinese herb we've run across that is not included in that book. Chinese medical actions. According to Bensky and his team, Abu Shirzao disperses wind cold and unblocks the nasal passages, used for a variety of acute conditions that block the nasal passages and sinuses, both topically and internally. Can be used by itself for this purpose, especially useful when accompanied by red and dry eyes. It disperses pathogens, resolves toxicity, and reduces swelling, used topically for toxic and traumatic swellings, as well as localized pain from painful obstruction, and this particularly applies to the macerated fresh product, so if you can actually find it fresh. It clears heat and stops bleeding for internal heat from excess causing the blood to move chaotically. Symptoms include vomiting or coughing of blood, nosebleed, and blood in the stool. Actually, I am so sorry, this slide should not be in here. We're going to erase that last one, and I'm going to take out this slide. Moving on, Chen and Chen says this herb opens the nasal orifices, removes superficial visual obstruction. For hypertrophic rhinitis, sinus polyps, nasal obstruction, Abu Shirzao herba Centipeda opens the nasal orifices to treat symptoms related to nasal disorders. For cataracts, Abu Shirzao removes superficial visual obstruction and treats cataracts. It also dispels wind and dampness and benefits the joints. For traumatic injuries and arthritis, Abu Shirzao treats arthritic pain caused by wind and dampness lodged in the joints after traumatic injuries. So you injure it and then you get arthritis. So those are the Chinese medical actions. Preparations. Bensky and his team, under the heading of nomenclature and preparation, simply discusses dosing. There's been much discussion in the Chinese literature regarding the appropriate dosage of this herb. While many sources advocate doses up to 30 grams, it is clear that significant side effects are quite common at doses above 15 grams. For this reason, 9 grams is the upper level of the recommended dosage. And I think Chen would agree to that. Chen often, they said, remember, they recommended 3 to 9 grams for this herb. And often what Chen will do is say 3 to 9 grams for this herb with a maximum of 15 or 30 or whatever. And they had no maximum. They didn't say that in this. In other words, 9 grams was their limit as well. Western uses. The PDR for herbal medicines does not have an entry on this herb, and it does not have an entry on www.webmd.com or any other major Western herbal databases based on a Google search. In other words, it appears to be primarily and exclusively a Chinese medical herb. Commentary. Bensky and his team has a short commentary about this herb. Centipeda herba Abu Shirzao is acrid and slightly warm, enters the lung channel, and is used internally primarily for unblocking the nasal passages and topically for swellings. While not particularly effective for treating colds itself, it has recently been used as an important ingredient in many patent medicines for allergic rhinitis and sinusitis. So patent medicines is a term that I don't care for. I don't think that's it is a good translation of the Chinese term, but there's a history at least in the US, of patent medicines being snake oil. So I don't like that translation. So I usually will translate that as prepared medicines. So this is an important ingredient in prepared medicines for allergic rhinitis and sinusitis. Comparisons. Neither Bensky and his team or Chen and Chen compare this herb with others. So not any comparisons with any other herbs. And I think, again, that is explained by the fact that this is a more obscure herb. However, there are combinations. Bensky and his team discussed several combinations of this herb with others, with indigo naturalis or Qingdai and Chuanchang rhizoma Chuanchang as a nasal sufflation for acute headache, nasal obstruction, and red and painful eyes. And I actually had to look up the word insufflation because I hadn't heard that before. But that is the act of blowing a gas, vapor, or powder into a body cavity. So in this case, blowing it into the nose. So I would expect this to be in like a puffer bottle, and you puff it into your nose for these conditions, for acute headache, nasal obstruction, red and painful eyes. Can be used with Magnolia flos, Xinyihua, Menthe haplocalicis herba, or boha, that's field mint, and Hatunier herba, or Yu Xing Cao for sinusitis. It can be used with Angelica dehurica radix by Jur, and Piperus longi fructus, Biba, has an insufflation for toothache, so you can put it directly in the mouth and for the toothache as well. Chen Chen also has some combinations with this herb. Those include for nasal disorders, use Abu Shir Cao with Fu Rong radix hibisci and Xinyihua flos magnolia in herbal decoction. The fresh juice of Abu Shir Cao can also be applied topically as nose drops, so that's interesting. Cataracts, combine it with Qian Li Guang or Herba senesionis scandens. I'm not familiar with that herb at all. And for pain, combine it with Yi Tao Gun radix moganiae, Jinbu Huan Herba lycopodi serrati, Mo Gu Xiao Callus Hyptis capitate, Huangjing Gui, Callus vinierae, and Liaojier Huang Herba solidaginis. I have not heard of any of those herbs. This would not be an herb I would think about for pain, honestly. This would not be one of the top herbs for pain, nor would this be a combination I would potentially use. But it's interesting. I love it when I learn about herbs that I'm not familiar with. All right, contents of this herb. According to Bensky and his team, the contents of this herb include volatile oils such as heptan-2-ol, hepta-2, 4-DN1-ol, isobutyric acid, benzyl alcohol, cis-chrysanthemol acetate, methyl linoleate, methyl palmitate, ethyl palmitate, hexacosanol. I put these in. First of all, I knew this was going to be a little bit short because there wasn't a lot of information on there. So I decided I was going to put all these terms in, which I probably would have not put them all in. And I'm like, okay, I'm going to challenge myself. I'm going to see if I can pronounce all these. I think I did pretty good, but I'm probably speaking too early because we still have a lot more to go. So also includes monoterpenes, sesquiterpenes, lactones such as arnicolide, brevelin, helenolin, tetrahydrohelenolin, floralenoline, steroids, including beta-sitosterol, which is a common steroid we see in herbs, triterpenes and triterpene saponine glycosides, and flavonoids, including various quercetins. There we go, the quercetins that we talked about earlier in this episode, and other constituents such as aurantiamide acetate. Okay, not too bad. I think I got through them pretty good. Tan and their team say a total of 191 compounds have been isolated and identified from Chinese medicine, including terpenes, flavonoids, sterols, phenols, organic acids, and volatile oils. So what about the science here? So that same paper, Tan and their team say The dried whole plant of Centipeda minima L.A. Braun and Ashers has been used as a traditional Chinese medicinal herb for thousands of years for the treatments of rhinitis, sinusitis, cough, and asthmatic diseases. The pharmacological effects of Chinese medicine, such as anti-cancer, I'm saying CM because I'm so used to CM being Chinese medicine. It actually refers to Centipeda minima. So the pharmacological effects of Centipeda minima, such as anti-cancer, anti-inflammatory, and antibacterial activities, have also been evaluated by both in vitro and in vivo studies. The signaling pathways and mechanisms of action underlying the anti-cancer effects of Centipeda minima have been revealed. Clinical applications of Centipeda minima mainly include rhinitis and sinusitis, gynecological inflammation, cough, as well as asthma. So we haven't talked about gynecological inflammation. We kind of talked about all the others, but that's an interesting one to include in this paper. This is a scientific paper that we're talking about here. Leo and their team discuss several uses for this herb, including the possibility of treating various forms of cancer, including nasopharyngeal carcinoma, non-small cell lung cancer, triple-negative breast cancer, liver cancer, and stomach cancer. Shang and their team add colon cancer and melanoma. The studies showing these benefits were mostly in vitro experiments on individual constituents with a few mice experiments. In other words, nothing clinically, and so I would bear that in mind with thinking about this as anti-cancer. They also discuss in vitro and in vivo evidence supporting its use for anti-inflammatory and antioxidant effects and asthma calming effects. Again, in vitro and in vivo does not mean clinical, so it means in animals and in bench research and in the lab. So I think it's established that the constituents can do all these things, but we need to see how they do clinically. We need studies to show that it can do the same thing clinically. Shang and the same team add anti-allergy, antidepressant, antibacterial, antiviral, hepatoprotective, so it helps the liver, protects the liver, and hair growth effects as well. Again, I don't think the evidence is super strong in any of these. There is evidence for all of these, but I think we need to see it clinically before we can say it's good science. Drug-herb interactions. A literature review did not find any general drug-herb, cytochrome P450, or P-glycoprotein interactions, and I just want to make a point here about this. So I do a lot. My book, I've looked up thousands, literally thousands of drug-herb interactions, and what I have found is that the more commonly used herbs generally have a lot more interactions because the commonly used herbs are researched more heavily than some of the more obscure herbs. So the reason why I'm saying this is right here with the drug-herb interactions. While a literature review did not find anything that we need to worry about drug-herb interactions, that may be more a function of the fact that this herb is more obscure than the fact that it doesn't cause any drug-herb interactions. In other words, I would still be cautious with adding this herb into a drug regimen. And we don't talk a lot about drug-herb interactions in Sperb's herbs necessarily, but that is one of my areas of expertise. And I have a saying that I always like to say, whenever you're combining herbs with drugs, I always say start low, go slow. In other words, start at lower doses and slowly increase the doses to therapeutic levels. And that way, if there is a drug-herb interaction, hopefully you catch it early before there's any serious effects or serious interactions. And so I just want to add that this would definitely, just the fact that I didn't find any drug-herb interactions, I would still be following my advice of start low, go slow if I were to add this herb into a drug regimen. I wouldn't be afraid to do that. I'm not afraid to add herbs into a drug regimen. I just want to do it with proper caution. And one of our textbooks, the American Herbal Product Association's Botanical Safety Handbook, does not have an entry on this herb. So usually they'll give a drug-herb interaction rating and a safety rating, and unfortunately we don't get either of those because it's not part of that book. Concerns. Bensky and his team say under cautions and contraindications, overdosage should be strictly avoided. Use with caution in those with gastric problems, particularly peptic ulcers or gastritis. Best taken within 1 hour of eating to minimize these side effects. Under toxicity, they say this herb irritates the gastrointestinal mucosa and can intensify the contractions of the stomach wall and lead to spasms of the smooth muscles, resulting in acute abdominal pain, epigastric discomfort, nausea, and vomiting. These reactions are rare at the suggested dosage. The same reactions appear after injection of preparations of the herb, so that makes sense. Chen and Chen echo these concerns, saying, use Abu Shirzao with caution for patients with weak digestive systems. Abu Shirzao is contraindicated in patients with gastritis or duodenal ulcer. So that's interesting. Bensky and their team said peptic ulcers, and here Chen Chen are saying duodenal ulcers. Those are different types of ulcers. So they're similar, but they're, the peptic ulcers are in the stomach and duodenal ulcers are in the small intestine. Under authors' comments, they say use of Abu Shirzao is sometimes associated with irritation to the stomach lining, which is why it should be used with caution in patients with sensitive stomachs. The side effects can be minimized by adding herbs that protect the stomach, such as Baiji, Rhizoma blatelia, Ubedza gala chinensis, Hai Piao Shao, Endoconcha sepia, and Chuanbeimu, bulbous fritillaria serosa. Liu and that team says internally taking Centipeda minima primarily affects the gastrointestinal system. More specifically, Centipeda minima produces burning feelings in the pharynx, esophagus, and stomach, plus nausea, vomiting, stomach pain, and even abdominal pain. Severe pain may be felt in severe cases for a period of time after drug consumption. In addition, some patients experience back and whole body pains. However, relevant clinical uses witness few cases of adverse reactions, which indicates that Centipeda minima is a relatively safe, mild, and effective herbal remedy. Corresponding studies show that out of 97 patients diagnosed with allergic rhinitis, 19 of them, or 19.55%, experienced transient adverse reactions. Furthermore, of these patients, 9 individuals, or 9.19%, encountered sustained adverse reactions leading to the discontinuation of the use of Centipeda minima. The remaining patients did not report any adverse reactions. Despite some potential adverse reactions, it is generally rated as a relatively risk-free, gentle, and potent herb with significant medicinal values that is extensively employed in traditional Chinese medical practice. Accordingly, to pursue the higher efficiency and safety of Centipeda minima, it is advisable to seek guidance from a medical expert or professional Chinese medicine practitioner. And that's our herb today. We started with a look at something a little different, an examination of quercetin, both a supplement used for various conditions and a constituent of today's herb. Then we looked at another single Chinese herb, Abu Shirzao, Centipeda herba, or small Centipeda herb. This relatively obscure herb still has some interesting uses, and yet we need to be cautious about its gastrointestinal irritation. And that was another exploration of a lesser used but still useful herb. In our next episode, we will be discussing a very popular Western herb, Echinacea purpurea, or purple coneflower. This herb is commonly recommended for treating and preventing colds. Does it have other uses? Does it work? Is it safe? How does Chinese medicine interpret its actions? We will answer these questions and more. And as usual, we will be adding something a little different. It's going to be another illuminating discussion of herbs, so please join us in 2 weeks. I'd like to say thank you very much. If you like this podcast, please do us a huge favor. Subscribe in your favorite podcast app or give us 5 stars or both, and we appreciate you even thinking about doing that. And thank you very much for listening today, and thank you for considering helping us continue to put out the word about herbs. Don't forget about our amazing continuing education deal. It is the end of it, so if you're going to do it soon. You can do that at www.integrativemedicinecouncil.org. That's council.org/CEUS1. That's, remember, half or more, quite a bit more than half off our normal price of continuing education, and you get a free book worth up to $80. You can always get in touch with me at Dr. Greg at spurbsherbs.com. That's SPERBS.com. Or at our website, www.spurbsherbs.com. We have an herb color code. If you ever wonder about why there's different backgrounds on the herbs, this is the reason. This is the color code for that. And we have, as usual, today we have quite the bibliography. There's a lot to cover. Even though it was small, it was a lot. Thank you very much. Appreciate it.